that's okay?
Do you have, I don't know.
I have a timer.
Okay,
It's okay. Go
thank
ahead.
you so much. My name is Joaquín Beltrán. I'm from the city of Downey. I'm with actioncareequity.org. My main message today is to urgently bring back mask requirements in healthcare settings immediately. COVID is airborne, and that's the primary way this virus transmits. And so we need to have the proper precautions in place. And the first line of defense right now is high quality masks, N95, respirators. So the community, by and large, wants protections. In fact, over 13,000 or nearly 13,000 letters have been sent to LA County Board of Supervisors, as well as LA Public Health, demanding the reinstatement of mask requirements in healthcare settings. Additionally, over thousands of calls have been made to the supervisors and LA Public Health as well, demanding the reinstatement of mask requirements in healthcare settings. What is the purpose of LA Public Health? It is to protect the people. It's not to play political games. Throughout history, there's always been people who do not care about what is going on with other people, the impacts that our actions have, right? Where is our conscience if we pass on the virus to someone else and they end up disabled or with long COVID, right? Or if they end up dead or their family member ends up dead because we passed on a virus because we weren't wearing a suitable mask. That is something we have to think about and live with and be conscious about. Healthcare settings should be places where people get better, not where people get sick, not where people get disabled, not where people can potentially get long COVID, not where people can potentially die. My own grandma, when she visited a vascular specialist, the vascular specialist said they don't like wearing masks. I told them, you know, COVID is a vascular disease, and they said, yeah, it is. And we need protections from the county in order to advocate for ourselves. If those protections aren't in place, people are going to keep getting sick, people are going to die from healthcare acquired infections. I have a friend whose mother went into the hospital for something not related to COVID. In the hospital got COVID, she died. That should never happen. I just want to check how much time I have.
25 seconds.
25 seconds. So this is important. Immunocompromised can't get adequate care, can't get safe care. We don't have the monoclonal antibodies anymore. You know, there's all this talk about we have the tools. Vaccines are insufficient in stopping transmission. Vaccination rates are low. They are low protection for long COVID. Number one defense are N95. We need to bring mask requirements back in healthcare settings. Thank you.
Thank you for your comment. With the last comments.
Comment?
Yes.
Yeah. I've been a practicing physician for 47 years, and I know the back and forth and how this goes. And about 20 years ago, I've been on this commission probably longer than anyone, four different supervisors. And Lester Breslow was chairing the commission then, Mr. Public Health. And the issue then was milk. What's the term? Pasteurized. That a group wanted to drop, no longer have the pasteurized milk. And you know, this goes back all the way to Jenner and longest time. And we voted unanimously at the Public Health Commission, no, this is a threat to kids and anyone at risk. And they had a public hearing down at the Board of Supervisors. About 200 people showed up, and the Board of Supervisors voted 5-0 against our recommendation to keep pasteurization in place. So, ironic how it goes. So we have a large clinic at UCLA, and you have to wear a mask.
Mm-hmm.
Or show proof of immunization to do it. So if you won't do that, I'm not going to work in our clinic further. reason, we don't want you to inadvertently sneeze on somebody's elderly grandfather or their child or something. So it's an ongoing battle. It's just
Yeah.
surprising.
The challenge is that vaccinations
Is it back and forth allowed?
don't provide.
No, back and forth.
There's no back and forth, sorry.
Don't provide prevention and transmission, right?
Right, but-
And so that's the problem.
So you can't say
Um,
anything.
There's no back and forth.
So thank
It was
you.
just a one-
No, I appreciate that. I appreciate the comment.
So the governor of Florida came out yesterday and said, this is all BS, the mask and everything, we're not doing it here.
So that's a bad model.
There's
Let's
no
let's
back
let's
and
have
forth.
let's have a great model here,
I'll
right?
turn the meeting
Yeah.
back open
Thank
to
you very much.
Thank you
It's
so
a great
much.
idea.
Thank you, ma'am.
For your comments.
Thank you, sir.
Yeah,
Um, With no more public comments, move to adjourn.
so move.
Second, we are adjourned. Thank
Thank
you,
you.
thank you very much.
Sir, if I can just get a word with you afterwards?
No, you can get a word with me now. What would you like to discuss?
Oh, it was about your